introduce today's speakers. Luis Belen has been CEO of the NHIT Collaborative for the Underserved since 2014, where his responsibilities include NHIT's relationships with the White House, Department of Health and Human Services, Capitol Hill, and community organizations. He earlier founded Medic Success, a company focused on providing health-related solutions for underserved communities and facilitating interface with private industry, nonprofit organizations, and government agencies. Julian Goldman, MD, is Medical Director of Biomedical Engineering for Partners Healthcare and an anesthesiologist at the Massachusetts General Hospital. In 2004, Dr. Goldman founded the Medical Device Plug-and-Play Interoperability Program to improve patient safety through the adoption of patient-centric integrated care environments. Matthew Quinn is advisor to both the MGH Medical Device Plug-and-Play Program and the National Health IT Collaborative for the Underserved. Previously, he was Intel's East Coast Managing Director for Healthcare and Life Sciences and Director of Healthcare Initiatives for the Federal Communications Commission. And Marshall Collins has served for 6 years as Research Analyst for the Consortium for Improving Medicine with Innovation and Technology, CIMIT, a nonprofit consortium of Boston's leading teaching hospitals and universities. In this role, Mr. Collins supports CIMIT's online process management tool, Collab, by working with collaborators to implement the CIMIT process. And today, now we'll begin with Mr. Belen giving us a welcome.
Well, thank you, Maggie, and welcome everyone to today's webinar. My name is Luis Belen, and I'm the CEO of the National Health IT Collaborative for the Underserved. I want to first start by thanking our sponsors. This challenge was made possible with seed support from the Gordon and Betty Moore Foundation, generous gift to the Massachusetts General Hospital, and Partners Healthcare's Medical Device Plug and Interoperability Play program, and the National Health IT Collaborative for the Underserved, Howard University College of Medicine, the National Human Genome Center at Howard University, TracFone, HIMSS. Together we came to launch this challenge to advance health equity through precision medicine tools. The challenge itself is being managed by the Center of Integration of Medicine and Innovative Technology, CIMIT, who's providing the challenge application management infrastructure. This challenge to us is extremely important. It ensures that underserved communities are being engaged in precision medicine and that tools are being tailored and focused to ensure underserved communities are benefiting and participating in PMI. So with that said, I want to thank you all for joining us and looking forward to receiving patients and the support of this applications throughout the process, and looking forward to reading your applications on November 21st. Turn it back over to Maggie.
Thank you, Mr. Belen. On your screen, you'll see our agenda. So following this welcome, we will go through the PMI Challenge overview by Dr. Goldman, the PMI Challenge requirements by Matthew Quinn, and the application process overview by Marshall Collins, followed by your questions, which either can come in today or in the future via email. I'd like to turn this over now to Dr. Goldman, who will be describing the challenge overview.
Great. Thank you very much, Maggie. This is Julian Goldman, and Maggie is driving the slides, so you'll be hearing me say next. So let's go through the challenge overview. Next slide. So this is, for all of you who are watching this now or following up later, you can learn everything that you need to know about the challenge from the website pmichallenge.org. When you go to pmichallenge.org, you'll see the screen that we captured here and are showing to you right now. And on the next slide, you'll see that a little bit more detail that we've taken from the website and enlarged so that we could easily see and review it during this webinar. Let's talk about the challenge background. So the Precision Medicine Initiative seeks to revolutionize how we improve health and treat disease by taking into account individual differences in people's genes, environments, and lifestyles. This is becoming an area of great excitement nationally and internationally since being launched by the President this past year. Accomplishing the goals of PMI and ensuring health equity more broadly will require deliberate strategies and efforts to ensure that all people, including those in underserved communities and those who are medically underserved, can access and reap the benefits of precision medicine. Next slide, please, Maggie. So let's drill down a little bit more into what we hope to accomplish and how we are going to address some of the current limitations in digital health tools. Digital health tools, as we all know, hold great promise in gathering data, in informing population and community health, and in delivering actionable information. But there have been significant shortcomings that we are all trying to overcome as a community. The shortcomings have limited the usefulness of the tools for use by either researchers or individuals. And these areas or gaps include the lack of tailoring for users, which has resulted in reduced adoption, especially over the extended periods necessary for integration into people's lifestyles and contribution to research. And secondly, lack of a framework for various digital health tools to work together to contribute towards integrated information has limited the use and usefulness of digital health tools in both people's lives and in research. Next slide, please. Okay. Oh, there we go. Thank you. So the challenge that we initiated with through our collaboration, and Maggie listed and Louise listed the collaborators, and you can learn more about them on the website, is the first of its kind initiative to inspire and fund entrepreneurs building digital health tools that will address the precision medicine needs of people in underserved and medically underserved communities, facilitate participation of people from underserved and medically underserved communities to the precision medicine cohort, and promote the use of open health platforms to expand the breadth, depth, and interoperability of digital health tools and associated data to support the Precision Medicine Initiative. So, waiting for the next slide. Let's see. I might be having a slow
You should be seeing slide 10.
There we go. It just updated. Thank you very much. So let's talk a little bit more about the background of the challenge. The challenge has been made possible through the collaboration of a number of stakeholders from the public and private sector, and that includes the National Health IT Collaborative for the Underserved, Partners Healthcare System, TracFone, HIMSS, Howard University College of Medicine, and the National Human Genomics Center at Howard University. And that's number one. Number two, a key part of enabling a challenge like this is having prizes. And we were fortunate to receive a generous gift from the Gordon and Betty Moore Foundation that was provided to the Massachusetts General Hospital Department of Anesthesia Medical Device Plug and Play program. And the funds are dedicated to be provided as prizes for this challenge. And number three, of course, the Consortium for the Improvement of Medicine through Innovation and Technology, otherwise known as CIMIT, is providing the challenge application management infrastructure. This is an activity that CIMIT has done before, supporting national challenges and education. On slide 11, we have a brief overview of our Medical Device Interoperability Research Lab, and I'm going through this briefly just to demonstrate some of the capabilities that exist here that might be of interest to the challenge participants. It isn't a requirement to use the resources that we have here, but we thought it would be worthwhile to point out the resources. Our laboratory is based in Cambridge, and we have an 1,800 square foot environment to support our program that was established in 2004. The environment serves as a vendor-neutral laboratory for experimenting with technologies and interoperability solutions that could include testing new standards, evaluating new technologies and products. This is a non-clinical environment, so there are no restrictions that would occur with testing technology in a clinical environment, but it has over $1 million of real medical devices and networking infrastructure to facilitate this type of research, exploration, prototyping, and demonstration. There's also access to clinicians, biomedical engineers, clinical engineers, and computer science subject matter experts. Part of what our research group has developed is freely available for this challenge, and that's a platform called OpenICE. It's open source software that you could find at openice.info, which has been funded primarily through federal grants and contracts from the NIH, the NSF, and the DoD. Next slide, please. So again, just continuing on a brief overview of the Medical Device Interoperability Program, you can see in this slide the quadrants of mission, projects, support, and resources. And the only two things I'd like to point out are mission, promoting innovation in patient safety and clinical care by leading the adoption of patient-centric integrated clinical or health environments, and the resources which we've touched on in several projects, which include a database of requirements that can be contributed to through this project so that future technologies are built in a manner that will be adoptable, will have a patient impact, and be capable of contributing to the larger interoperable ecosystem. So next slide, please. With that, I want to hand off the details of the challenge requirements to Matt Quinn, and I'll be standing by, as are all the presenters today, for questions that come up at the end. Matt?
Thank you so much, Dr. Goldman. I'm Matt Quinn, and I will be covering the challenge requirements for today. Next slide, please. So let's start with some of the details about eligibility and prizes. Eligible organizations for this challenge are individuals as well as organizations, public and private, willing to abide by the challenge rules, including committing to development in a way that maximizes interoperability and use of open standards. The prizes for this competition include cash prizes for first, second, and third place winners, as well as mentorship for the winners in their journey from envisioning to deploying and potentially commercializing these digital health solutions. Next slide, please. The timeline. The submission site opened a couple of days ago. Today we're having the informational webinar, and we're going to make this available on PMIChallenge.org for those who can't make it today and would like to check this out. Please read it. The pre-proposal submission deadline, and Marshall from CIMIT will cover how to provide that, is November 21st. We're going to announce the wave of finalists at the National Health IT Collaborative's 3rd annual conference in Washington, D.C. in December 14th. Full proposals for those finalists will be due in January to provide a little bit more information. And then the winners will be announced at the HIMSS annual conference in February in Orlando. So we've laid out 2 rounds for the process. So the application requirements, and this will be instantiated in the application website that we're going to demonstrate for you in a couple of minutes. We've tried to make this as lightweight as possible. So we want to know who are the teams, their bios, their locations, and why they're participating. What's the motivation for this? Second, we want a precision medicine tool concept or prototype description, including a description of the intended users and rationale and evidence that the envisioned precision medicine tool or prototype would actually be used and provide value for those intended users. We want a description of how the team and tool will facilitate participation in the Precision Medicine Initiative, PMI, or enable improving clinical care. And then finally, a commitment to development in a way that maximizes interoperability and use of open standards. Those are the rules. Next slide, please. So the judging criteria are closely aligned with the goals and the needs, actually, of both PMI and digital health tools. So half of the evaluation will go to the degree to which the tool or solution that's proposed supports scientifically valid data collection from individuals in underserved and/or medically underserved communities in a way that contributes to the precision medicine cohort. And this is an important part because the goal here is to help achieve that 1 million person goal and representation from underserved communities. Second, if people don't use the tool, then it's not going to work. And so 30%, a big chunk, goes towards the degree to which the applicant team demonstrates that their tool or solution addresses a real-world need of individuals in underserved and/or medically underserved communities and is likely to be adopted and used. So evidence of this in the application is important. And last but not least, a big chunk goes towards the degree to which the tool or solution conforms and contributes to open interface and architecture standards, such as the ones listed here, not the least of which is ASTM F2761, or the Integrated Clinical Environment, that you can find out more about on openice.info or the mbpnp.org website. We want the participants in this to be part of open source and maker communities and to demonstrate that in their concept that they proposed. Next slide, please. So I'm going to hand it over to Marshall Collins from CIMIT to talk through and demonstrate the application process for getting that information to the judges. Thank you.
Great, thank you, Matt. So it looks like I should be sharing. Can you see the screen? Maggie?
Yes, we can.
Okay, great, thank you. So I'm going to quickly run through how to access the application site and then the steps that you'll take once you have an account to log in. So there is the home page from PMIChallenge.org, and you click over to Challenge Submissions, and here you have the application requirements that was just gone over there. And as you scroll down, you will have the ability to create your submission, and you get to the following page. Now, the majority of you will need to have an account where you just click to have an account, and then it's the standard process for creating an online portal account with your first name, last name, email of your institution, or Gmail, Yahoo, whatever account that you have, along with your password. And then this will take you to a confirmation email, which you will accept and then have an account ready. Once you have an account, or if you already have one, you'll click in here. This is standard login info. Here's my testing account. As I can't type. And right like that, you are created an application, and this is your kind of work site that you have, which you, once you create it, you can log out and log back in whenever you want to start the application again. And here you have 2 tasks, and once these 2 tasks are complete, then you'll have the ability to submit your application. So part 1 of this is just general information, including the name of your application, complete your name, and then your institution, So that part is done. I can go back in and edit. Again, I can log out, come back in, and complete it later. And the upload an application is to complete one merged PDF of all the requirements that was stated before. So the description of your challenge, your biosketches, bios, and why you're doing that. So this will pull in right from your desktop. And here you can select any PDF that you have. If you try to submit a PowerPoint or just a Word document, that won't be accepted, so it does have to be a PDF. And here it comes in, and then you'll get a quick preview of your application that you've done. You can click back to get into your application, and now that both of these are complete, they're almost there. All you have to do now is to click here to submit your application, and you're all set. So now you can go back home, you can go back in, you can see what your application is. But as I said, once you click to confirm, you will no longer be able to access your application, or you can go back and submit a new one. One thing to notice is that this is accessible outside of any firewalls that your institution may have. This is also available on your mobile or tablet. It is responsive, so you will be able to access it any way that you'd like. And that's pretty much it. So you can see, you can invite other members in. If you want them to be completing the other general information, if you have multiple team members, that's all you have to do is click to add members. And it's 1, 2, 3, just click submit, and that is the end of the pre-proposal. So with that,
Marshall, before you go, Julian here, could you clarify the role of the team members?
Sure. So if you have other members that you want in who are working on a proposal with you, you can add them in, and they will be able to read or access and edit the same task that you are. Now, granted, this is a relatively short application, so you may not need, a large team with you. But if you want to, if the PI wants to be the name on the submission, you can invite other people in to actually complete the upload application task or the general information form.
Great, thank you.
So with that, Maggie, I think I'm going to try to pass it back to you here.
Thank you.
I can see your screen now.
Perfect. Thank you, Marshall. And for those who are listening to this after the event, we do have a number of screenshots of the live presentation that Marshall just gave in case you would like to share those with anyone that may be interested. Now, we've provided you with a lot of detailed information. We really hope to cover everything that you would need for a successful submission. If anyone in attendance would like to submit a written question, if you'd use the questions box in your GoToWebinar control panel, following this event, you can also submit the questions by email. I do have one question that was submitted in advance, and I believe this question will be from Marshall. If I have any technical questions regarding the application submission portal, where may I send those questions?
So if there's basic questions about the application, they should be found on the site, but if you have direct technical questions about the portal itself, you can email me directly, and my email is there on the screen, and I will be able to log in and help you through any questions or issues that may pop up.
Okay, great, thank you. Okay, we have no other questions from the audience at this time. So again, if anyone who would like to submit questions generally to the challenge, I have the final slide. It shows the PMI Challenge at NHITunderserved.org web email address. Please feel free to send questions there or to any of the panelists listed on the screen. I'd like to thank
Maggie,
all of our panelists. Oh,
before we go, Maggie, Julian here, I have a question for you. So when someone, in order for someone to find this recording, the link will be posted on one of the pages on the PMI Challenge site? Is that the plan?
Yes. We will be, I believe, posting it under that PMI Challenge application process tab.
Okay, wonderful. Thank you.
Thank you for asking. Okay, we have no other questions, so I'd like to thank our panelists for today and thank for those who attended. And we look forward to some really innovative and exciting applications, and look forward to seeing you at the awards ceremony. Thank you, everyone. And Louise, if you could end the recording.